What is the difference between diffuse and intestinal stomach cancer? Imagine walking into a room and seeing two very different types of puzzles. One puzzle has pieces that fit tightly together, forming a clear picture. The other has scattered pieces that don't seem to connect easily. This is similar to how intestinal and diffuse stomach cancers behave and look under the microscope. Intestinal-type stomach cancer is like the tightly fitting puzzle. Its cancer cells tend to stick together and form gland-like structures, similar to the lining of the intestines. These tumors often develop in areas of the stomach that have been inflamed for a long time, especially where the stomach lining has changed to resemble intestinal tissue. They usually grow as larger, cohesive masses that can be seen as ulcers or protruding tumors during endoscopy. Because they grow more slowly and from distinct masses, they are often diagnosed earlier, which can lead to a better outlook. On the other hand, diffuse-type stomach cancer is like the scattered puzzle pieces. The cancer cells in this type do not stick together well because they lack a protein called E-cadherin, which normally helps cells stay connected. Instead, these cells infiltrate the stomach wall individually or in small groups, spreading widely without forming a clear lump. This infiltration causes the stomach wall to become thickened and stiff, a condition sometimes called linitis plastica or leather bottle stomach. The diffuse type often involves younger patients and can be more aggressive, making it harder to detect early and leading to a poorer prognosis. From a molecular perspective, the loss of E-cadherin in diffuse cancer is often due to mutations or changes in the gene that produces it. This loss allows the cancer cells to detach and invade surrounding tissues more easily. In contrast, intestinal-type cancers are more often linked to infections like Helicobacter pylori and environmental factors such as diet. They tend to have genetic changes like chromosomal instability, which can lead to the formation of visible tumors. Epidemiologically, intestinal-type stomach cancer is more common in older men and in regions where stomach cancer rates are high. It usually develops slowly from precancerous changes in the stomach lining. Diffuse type, however, tends to affect younger individuals, sometimes runs in families, and is more common in areas with lower overall stomach cancer rates. It often affects the middle part of the stomach and can spread quickly. Clinically, intestinal-type cancers often present with symptoms like ulcers or noticeable masses, making them easier to find early. Diffuse-type cancers may cause symptoms like stomach stiffness, pain, or weight loss but are harder to detect early because they don't form obvious lumps. Their infiltrative growth pattern allows them to spread within the stomach wall and to other parts of the body more rapidly, leading to a worse outlook. In summary, the main differences between these two types of stomach cancer lie in how the cancer cells grow and spread, their molecular makeup, the typical patient profiles, and how they appear and behave clinically. Recognizing these differences helps doctors decide on the best approach for diagnosis and treatment. If you or someone you know has concerns about stomach health, always consult a healthcare professional for personalized advice and appropriate testing.